I congratulate the ministry and the National Medical Stores for constructing this very good facility. Congratulations. I want to thank the government because they put on the money and the Gavi, the Global Fund, the United States government, and UNICEF. I think you all Kusonda. There was Okusonda. Ababona Basonda. Okay. Okusonda is, those who don't know our language, is when you want to buy alcohol in the village and you don't have enough money, you contribute until you buy a whole pot. It's Okusonda to do things by contribution. The facility, as you heard, is a good one, and as I saw, it serves part of a portion of the health systems. Because the health systems are linked. There is the acquisition of drugs and storing them well. So this one solves the storing well and in big quantities. However, the government is determined to get out of dependency on the issue of drugs and vaccines. We are now talking of the pathogenic economy. Because these diseases are not only a problem, they are also money makers. So if we are to be sick, let's get money out of our sickness. I was looking at the figures. The global business of pharmaceuticals is 1.4 something trillion dollars. The global business of all this, of the medicines, the vaccines, is 1.4 something trillion dollars. Of that, Africa makes only about 40 billion, 50 billion. This is not good. This is how Africa lags behind all other continents. And here we are going to get out of that. We are doing everything possible to make the drugs here. All of you, partners and friends, need to work together to solve the other issue of the last mile of the drug. From here to the district, from the districts to the health center, and what happened thereafter, because this is where the big problem is. I know it is Pan-African, you know I'm a big Pan-Africanist, but I don't think stealing drugs on a Pan-African scale is a good idea. So we must solve this. We must solve this. Of course, our neighbors need those drugs. The people in Congo, the people in South Sudan, they need them. But we need a better system rather than planning for Uganda health centers, and then the drugs end up in the whole of Central Africa. That means nobody will get served. The Ugandans will not be served enough, but even the neighbors will not get enough. So we need really to analyze this whole issue of drug supply during this time of lawlessness in this whole area. So I'm very happy to be here. I thank all the partners for contributing. But please, the other issue of taking the money away from you and to Minister of Health and then coming back to Minister of Finance, I think that is simple. They should not take away your money. They should keep it here. So that you can use it, but we shall sort it out. It's not a big issue. I think the bigger issues are what we have said. Number one, the Pan-Africanization of these drugs here, which are only meant for Uganda. Two, local manufacture of these medicines and vaccines. And three, public health, stopping many of the preventable diseases from attacking our people. In that way, we shall have a robust and maybe cost-effective health system. I don't know how much expense we go into because of not doing that. How much more expense do we incur? So, with these few words, I congratulate everybody. And the structure is commissioned and approved with all the comments taken into account.
On behalf of the United States government, I congratulate you and the government of Uganda on accomplishing yet another milestone in improving services for the country's people. This milestone, the completion and the inauguration today of a new warehousing facility for national medical stores, will help ensure that much-needed medicines and health supplies are properly managed from receipt to storage and onward until their ultimate delivery to the health facilities and use by those in need.
The completion and commissioning of this new warehouse and office complex is a further demonstration of the government's commitment to ensuring availability of quality, essential medicines and health supplies to government health facilities for the benefit of all Ugandans.
The design and build model that was used in putting up this complex saved us a lot of costs. The total cost for this warehouse complex structure and the high-tech equipment cost us $69.589 billion.
Underscore the strong and consistent support of the Minister of Health and the whole of the Minister of Health. This has been very critical in making sure that this project is completed. It has been a huge project, and we are very grateful to this collaboration on the government side. We also want to underscore the appreciation of our government partners who have supported us in all our efforts.
The structure before us today, reported to be the largest medicines warehouse on the entire continent of Africa, and surely the largest in East Africa, and more importantly, the most modern and up-to-date technologically, stands as a testament to the power of partnership to achieve the shared goals with the government of Uganda, providing not only the vision, but also a substantial amount of the financing for the entire facility.
Over the last 20 years, the Global Fund has invested over $2.2 billion US dollars in Uganda, working side by side to successfully reduce the disease burden and build resilient and sustainable systems for health. The investments that the Global Fund and other partners have made in Uganda's health system have been bolstered by your strong and visible leadership, Your Excellency, as evidenced by the health priorities in Uganda's Vision 2040 and all prior national development plans. Our distinguished high-level partners, Permanent Secretary,